Piece of it all. I am light. There is a woman in Somalia scraping for pearls by the roadside. There is a force stronger than nature, keeps her will alive. That is how she lives her life. She is dying to survive. I don't know what she's made of. I would like to be that brave. She cries to the heavens above. There's a stone in my heart. She lives a life she didn't choose, and it hurts like brand new shoes. Yes, it hurts like brand new shoes.
Hello, welcome to everyone who's joining us today. We'll be starting in just a few seconds.
Brand new shoes. There is a woman in Rwanda. The sun shows her no mercy. The same sky we lay under burns her to the bone. Long as afternoon shadows, it's gonna take her to get home. Each grain carefully wrapped up, pearls for her little girl. She cries to the heavens above. There's a star in my heart.
Thank
She
you to everyone. We'll
lives
be
a
starting in just a
life she
few
didn't
moments. We're just
choose,
giving a
and it
couple of
hurts
extra seconds
like
for folks to join
brand
us
new
via the waiting room, so we'll be
shoes.
getting started shortly.
Yes, it hurts like brand new shoes. And it hurts like brand new shoes. There's a woman in Somalia.
We've got a lot to cover today, so we'll go ahead and get started.
Rwanda.
Thank you, Daisy, for the wonderful music. We're already getting some comments in the chat. Welcome, everyone. My name is Julie Beeman Jackson, and our team is excited to launch the Foundational Technical Assistance Series hosted by the National Early Care and Education Workforce Center. Today's webinar is being recorded and will be shared out via email and on our website. If you have any questions today, please put them in the Q&A section area at the bottom of your screen. And if we're not able to answer all of the questions during the webinar, we will send out written responses to participants. Next slide, please. Before we get started, we wanted to share this message with our attendees. The work of the center is funded by the Administration for Children and Families. However, the views and perspectives shared during the webinar do not necessarily represent the views of or an endorsement by ACF. Next slide, please. So we'd like to introduce who's joining us today, and we'll start with our facilitators. The facilitators for the entire foundational series are Dr. Sherry Killen Stewart and Dr. Aisha Ray with the Build Initiative. You will see Dr. Killen Stewart and Dr. Ray today and throughout the series. In addition to Dr. Killen Stewart and Dr. Ray, you'll hear from Dr. Caitlin McLean with the Center for the Study of Child Care Employment, as well as our partners. You'll learn about strategies from our partners, Dr. Kimberly Belcher-Badal with the National Workforce Registry Alliance, and from folks working in the state of Nevada to create change for the ECE workforce, Shelley Nye with the Nevada Registry, and Maura Snyder from the Nevada Department of Health and Human Resources. Next slide, please. So as we get started today, we'd like to have you participate in 2 questions that's part of our opening poll. So as we mentioned, the foundational series is a series, and if you participated in or watched the video of webinar 1 of the foundational series on October 23rd, did you share information with 1 or more colleagues or members of your network? Then please choose from one of the choices below. Yes, plan to do so, but have not yet shared. No, and did not participate in the webinar or view the recording. So we'll just give folks a minute to respond to that first question before we share out the results. Are we able to share the results for the opening poll?
Yes, we have a total of 84% so far, and the results are there on the screen for you. And if you scroll down, you'll see replies to both questions 1 and 2.
Awesome. And our second question was just about where are folks coming from that are joining the webinar today, and where you are in terms of advancing policies, practices, or services to intentionally benefit the workforce. So thank you for participating in those polls. We hope that you are able to certainly gain some knowledge from today's webinar. Next, we'll turn it over to Caitlin, who will share more about the next section of our presentation regarding data.
Thank you so much, Julie. Welcome, everybody. So glad to have you all with us today. So I know many of you have just joined us for the first time, but during our webinar last month, webinar 1, we learned about the root causes of systemic injustices and inequities that persist today, challenging our efforts to support the early care and education workforce and to build a better, more equitable early care and education system across communities. And so today, to really build on what we learned in webinar 1, we'll be talking about how data and information about the ECE workforce can help us shift policy and practice to address those challenges. We'll talk about how, in order to create systems change, we need not just any data, but the right kinds of data. And whether we're working at the state, local, or tribal levels, data can help us answer important questions. Questions like, what percentage of early educators have left their jobs in the past year? Or what percentage of early educators have access to health insurance or don't have access to health insurance? And things like, what do educators say that they need in order to be supported in their everyday practice with children? And so just to get us started, we want to think a little bit about what do we already know about the early care and education workforce in our own communities. And this could be in your state, your territory, your tribe, or your own program. So what we're going to do now is give you an opportunity to share something that you've learned about the workforce in your community with your peers. And you can scan the QR code to take you to a Mentimeter page where you'll be able to input your own answers. And so we'll give everyone just a minute or so to get in and add something that you'd like to share. And when you're ready, make sure that you hit the submit button. So again, just think about what's a data point that you can share that you know about the ECE workforce in your community. And Daisy, as we start to get some results, feel free to pull up the Mentimeter. All right, it looks like we've got some great responses in here already. So things that we know about the ECE workforce. They're struggling, yes. Underpaid, and underappreciated. Diverse. Is he struggling again? Infant toddler teachers have higher turnover. And yeah, a lot about turnover in here. Highest turnover ever someone has shared about their community. Shortages. I like this about having passion for the work, but the pay not meeting their passion. That's so true. Educators make about half what K-12 teachers make. Providers are closing. The 98% of other professions make more than our ECE workforce. I'm so thrilled that somebody knows that. We're going to come back to that later in this presentation. All right, terrific answers. Our workforce is mostly home-based. That's another good one. So we know a lot about our early care and education workforce. We know that they are diverse, underpaid, passionate, struggling. And these are all reasons that we're here today, right? That we want to think about how can we better support the early care and education workforce, and how can data help us do that? So for our next question, we want to invite you to think about, okay, you know what you know, but what questions do you have about the ECE workforce in your community? What do you want to know that you don't yet? And same as before, you can scan the QR code, type in your responses, make sure you hit submit when you're ready, and then we'll pull up the results and we'll talk through what you all want to share about the questions that you have about the ECE workforce.
Technical assistant activities, and that's really 60% of our teachers technical assistants. And so it informs things like our community's practice and what the focus of those.
I couldn't quite tell if someone in the audience wanted to comment or have a question, but I think we'll get those results up and talk through those. And if you have a question, you can use the Q&A. All right. Some great responses here. Questions. How best to support them? That's a terrific question. What do educators need to make their daily work better? That's also a terrific question. What keeps you from leaving the profession? How can we work together to advocate for what they need? Where can we find more funding? Always very important. Why don't they unionize? That's an interesting question. How big is the shortage and why are staff leaving? What will entice folks to stay? What motivates people to stay? So some common threads here. How can we support them in identifying their professional training and coaching needs? How do we build the political will to increase wages? Not just get them to livable wages, but thriving wages. That's terrific. And again, thinking about what support is needed. All right. Well, keep your questions coming. These are all really terrific. Really appreciate you participating in this and thinking about what are those questions that you have and what do you want to know. Keep those in your mind as we keep going through the presentation. So for now, we're going to move into the heart of our presentation today. Again, really thinking about why data matters and how we can use data to, answer some of those questions that you brought up before. Really thinking about how can we support the workforce better? How can we improve our policy and practice? And I want to begin by sharing that the National ECE Workforce Center has recognized the central importance of data to making change. You can see on the slide here 5 essential policy areas that have been adopted as the National Center's guiding framework, really to guide all of our work through technical assistance like this series, but also the research that we're doing. And this is really about thinking through what do educators need to thrive and how can policy support them. And so when you think about each of these areas, a lot of which came up in some of the questions that you already talked about. So for example, with qualifications and educational supports and folks asking about, what professional development needs do educators have? But thinking about each of these policy areas, work environments, compensation, financial resources, and how not only are all of these interconnected, but in particular, since we're talking about data today, I want you to consider how access to workforce data can support each of these other areas. For example, maybe you're thinking about how much new funding or financial resources that you need to open additional classrooms. And so you need a sense of, how many teachers are leaving, right? People were talking about that earlier. How many additional teachers, teaching assistants, other positions might you need, and thinking about how much that would cost. Or maybe you're thinking about how to improve compensation. And so you need data on the current wages and current access to benefits and how that might differ amongst different groups within the workforce. Or you might be thinking, in my Head Start program, what additional professional supports do my teachers need to succeed? And we heard a little bit about that earlier. Next slide, please. So I just really want to reiterate that it's important to think about the kinds of data that you might need in relation to those questions that you want to answer. And so on the slide here are just a few examples of questions in each of those policy areas that I highlighted before. Again, just a couple of examples. So under qualifications and educational supports, you might be thinking about, what percentage of the workforce in our community or in my program has participated in scholarship initiatives? And are there differences between folks who have participated and who haven't? Because questions like that can help you think about, are there reasons that folks aren't accessing the supports that you do provide? And asking questions like that and then getting the data to answer those questions is crucial to improving equity in our field, like we talked about in webinar 1. For example, if you find that dual language learners are less likely to access your scholarships, you might consider that you need to offer materials and coursework in languages other than English to facilitate that access. Next slide, please. I want to briefly highlight that data comes in many forms. It can be quantitative, so you might be thinking about information that you've gotten from your community's registry or from a survey that you've done, but it can also be qualitative. So you might do focus groups or interviews with providers. And I want to be clear that both of these types of data are important because they provide different types of information. So you might summarize quantitatively the number or percentage of the workforce according to different demographic characteristics, or understanding, how many educators have attained certain education or experience levels. You might want to know, again, how many educators have or don't have access to different workplace supports, like paid breaks or planning time. You might want to understand numerically how these things change over time, perhaps in response to a policy or practice change that your community or maybe your program has implemented. But at the same time, quantitative data has limitations, especially for capturing nuance when you're thinking about people's experiences, their perspectives. And so if you really want to dig deep on an issue with members of the workforce to understand, how a policy or a practice is affecting them, that qualitative data through interviews or focus groups can really help you dig below the surface of what quantitative data can tell you. And then lastly, I just want to reiterate and mention that data can exist at multiple levels. So you might have national figures that differ from the specifics of your own state, your territory, your city, your tribe, or your program. Next slide, please. So now we understand the different types of data that are out there and the importance of using questions as a guide to the data that we need. But what do we do once we have some data? How can we use it? Now, data can really be used in a variety of ways, depending on your own role and what you're looking to do. It can be used for planning, making decisions, monitoring progress, and so on. And this is important if you're working at the state level, of course, but also if you're at the local level. You might be looking at data because you want to understand things better. Looking at your community strengths, your assets, thinking about where there might be inequities, who might not be benefiting from existing policies or practices. But you can also use data to take action. So you can identify strategies or actions to address those disparities that you've uncovered with your data. You can make the experiences of educators visible. You can make visible those inequities that folks may not already understand are there. And you can monitor the consequences or the impact of strategies over time, whether they're intended or unintended, and then think about making adjustments to improve. And data can help you with all of these things. Next slide, please. So I want to briefly share just one example of how a state, Virginia, has used workforce data to change systems and policy. We know that many communities have been struggling with efforts to retain early childhood educators, and we heard that from you all earlier. And this example from Virginia shows how community leaders partnered with researchers to collect and analyze data on the impact of a workforce initiative. So the Virginia Department of Education, the Virginia Early Childhood Foundation, and researchers from the University of Virginia established a partnership in 2019 when the state was awarded preschool development birth through 5 funds. And as part of that research policy partnership, they rolled out what was called the Teacher Recognition Program, which is a financial incentive program designed to support teacher retention. And as part of those financial rewards that they put out, they also included funds for a study to look at the impact. And so the study collected teacher level data, looking at their demographics, their employment status, their education, and their compensation, to really look at differences between those folks who got these financial awards and those who didn't. And they found this striking finding that financial incentives essentially cut their turnover rates in half, from 30% to 15%. And as a result of having this information, they were able to expand their program with increased funding. So the state actually put in $20 million into expansion. So this is really a terrific story. Huge congrats to anyone who might be from Virginia on the call. But this is just one example of how workforce data can be leveraged to make change. And it really illustrates how collaborating across roles is so important. So state level leadership partnered with researchers, but this effort and the increased funding that resulted would not have been possible if individual program leaders and educators didn't participate in those data collection efforts. And so there's really this collaboration across leaders that made this possible. Next slide, please. Now I want to turn to where you can find sources of existing data on the early care and education workforce. I'm going to spend a little bit of time talking about the Early Childhood Workforce Index, which is a report that my research center, the Berkeley Center for the Study of Child Care Employment, puts out every few years. The latest one came out in 2020, and we are hard at work on a new edition. And I want to start here because not only is the index a source of data, but it can also point you in the direction of additional data sources. So just to give a brief overview about what the index is, as I mentioned, it's a report, and it's kind of a state of the states report that is focused entirely on the status of early childhood educators, those serving children from birth to 5 across settings. And it provides a national picture, but also information for every state, DC, and the territories. In our new edition, we're working on a new tribal profile as well, so that will be an exciting addition. And I want to be clear that this type of information is not only important for state leaders, but also for local and program leaders, so that you can understand the context in which your own program or programs operate, and consider how you might be able to better support your teachers by understanding that broader context. For example, are you paying above or below the median wage for educators in similar programs as yours? Is your program offering benefits that are common or uncommon in other programs? Next slide, please. I want to give just a very brief overview of some of the types of data that you can find in the index. We report extensive information on wages, median wages of early childhood educators, and how they've changed over time. We also compare this to other benchmarks like what K-12 teachers earn or to the state's living wage. We also report on poverty rates and use of safety net programs like Medicaid or the Earned Income Tax Credit. And most of this information we have for every state as well as nationally. And so we get this information from federal data sources like the Bureau of Labor Statistics and the Census, and then we analyze it and publish it in the index. Next slide, please. So I want to give an example of how data can uncover inequities in ways that you may not even know about, inequities that you may not know exist. Our 2018 index did an in-depth analysis of data from the National Survey of Early Care and Education. And when we did that, we identified wage gaps for early childhood educators of color and educators working with infants and toddlers, as many of you heard about during webinar 1. And at the time, a lot of us thought this was probably the case, but we didn't have good evidence. And so having that data source and being able to do that analysis allowed us to have that evidence and document these inequities. And so since we reported this in 2018, our field collectively has a much better understanding of how educators of color are even further disadvantaged than their white peers in our field, which is already overburdened and underserved. And so that is the importance of data. Next slide, please. I want to come back to those 5 essential policy areas that I mentioned earlier. And I want to be clear that this framework was originally developed as part of the very first Early Childhood Workforce Index in 2016, and it continues to be used in every edition. And so what that means is the index not only includes data on wages and poverty rates, like I mentioned earlier, but it also includes data on which states have various policies or initiatives that fall under these policy areas. For example, under qualifications and educational supports, the index provides information on whether a state has different types of scholarship programs, like scholarships for CDAs, Child Development Associate credentials, or equivalent credentials, associate or bachelor's degree scholarships, those types of educational supports. And then under other areas like compensation and financial relief, the index provides information on which states have a stipend program to offer wage supplements. So those are just a couple of examples, but the index provides that type of information for all of these policy areas. And as I mentioned, the index is a report, but it does also have an interactive map and a profile for every state, as well as a territory profile. And so this type of information, which states have certain policies or what the median wage is for that state, can be found through the map or the profiles. Next slide, please. Now, since workforce data is one of the policy areas that the index provides information on, I want to just briefly explain how you can use the index not only to find specific national or state data points, but also to get a better sense of what additional data your own state might have. And on the slide here, it's just one example from one state from 2020. It's really just to help illustrate the type of data about the data that the index captures. So one thing that we look at is what types of data collection mechanisms does the state have? Typically, this is either a registry and or a workforce survey of some kind. So you can see in this state, they had both a registry and a survey. And then we also look at the types of information included in those data sources, starting with which parts of the workforce are included in the data. That's often a key question for all of us. It can be so difficult sometimes to get information across the full spectrum of the workforce. So for example, are educators in all licensed childcare settings included, including folks in centers as well as homes? What about Head Start teachers or pre-K teachers, whose settings may not be required to be licensed, depending on the state, or educators in licensed exempt settings? So if you see that licensed only or licensed plus, that's just a kind of shorthand in the profile, indicating whether one or more of these other folks in the field are also included in the data source. The index also asks what types of data elements are included in these data sources. So there are a lot of things, as you all highlighted earlier, that you might want to know about your workforce. The index can't look at all of them, but we do just include a couple. So we look at, do they collect wage data? Do they collect benefits data, health insurance, that type of thing? And do they collect data on race and ethnicity? Just as a couple of illustrative examples of what you might want in your data source. And then lastly, the index looks at whether the data is reported publicly, so that leaders like you can access it and use it in your planning and decision making. And then if the data is public, we try to include links to it in our appendices so that you all can find it easily. And again, this is just an example from one state, but I want to highlight that the index can be a resource not only for understanding the context within your own state, but also thinking about what's being tried in other communities that could spur ideas for your own community. As an example, let's say you look at your profile and benefits data is not being collected, but you really would like it to be because you have questions about this. So then you could use our interactive map to find your, another state that is collecting benefits data. You can look at what they've been collecting and how, and you can start to use that to think about a plan for how that information could be gathered in your own community. Next slide, please. So the Workforce Index is a helpful starting place because it includes lots of data already about the ECU workforce that can be compared across states. And it also includes links to more detailed data, those state registries and workforce surveys that I mentioned before. But that being said, the index has limitations like all data sources. The most important one for your purposes is that the currently available index is a few years old now. And so it likely doesn't fully represent where your community is as of this moment. But we are working on a new edition, so that should be helpful. But it's also true that one source of information will never be able to answer all of the questions that you may have about your workforce. So again, the index can be a starting place, but listed on this slide are several additional resources for finding good data on your workforce. And I'm not going to go through all of these, they're just kind of here for your reference. But I'll just highlight that in a few moments, you'll hear from Kimberly at the National Workforce Registry Alliance. So you'll get much more information about registries in just a bit. Next slide, please. So as we start to come to the end of this part of the presentation, I want to highlight that data is a very useful tool, but it's not perfect. Building the workforce that we want and supporting educators to thrive is sometimes inhibited by not having that data that we want. Sometimes there are gaps in existing information. For example, there's not a lot of information about Indigenous early childhood educators. There's a real gap in our understanding. There may be gaps on not just folks in particular communities, but gaps on particular topics, like the needs of dual language learners. And so ultimately, it's important to critically assess any information that you come across, and that includes data sources on the ECE workforce. You need to understand whether the information comes from a trusted and reputable source, how the information was collected, why it was collected, and importantly, who might it leave out? Where might those gaps exist? Next slide, please. And I want to leave you with one final point. The importance of directly engaging with educators, in addition to collecting and analyzing data about, educator characteristics, working conditions, all of those great things that we talked about earlier. And so on the slide is a quote that we published in our 2020 Early Childhood Workforce Index. It comes from a separate formal study of California early childhood educators, also by our center. And it really highlights the importance of those other types of qualitative data collection procedures. As I mentioned, this was a systematic study where we held focus groups. And so that might be something that you consider in your community in order to dig under what you're finding with your survey or your registry. But you might also consider more informal engagement as well, in addition to that systematic data inquiry. Things like convenings or other interactions with educators. As an example, our Berkeley Center engages with educators regularly as advisors to our work, so not just as formal research participants, as is exemplified here. Earlier this year, we hosted 2 convenings with early childhood educators across states to discuss our policy recommendations and what they would like to see changed about our ECE system. So coming back to some of those questions that you had earlier, thinking about, what do educators say that they need, right? Many of you mentioned that. So I just want to leave you with this understanding of how important it is to recognize that the numbers only tell part of the story. And you need the voices of those doing the work to truly understand current realities and what needs to be improved. So thank you all very much, and I will hand it over to Sherry.
Thank you, Caitlin. As we transition to you answering a couple more polling questions, just want to do a quick summary, give you some key takeaways. One is that data is really required to understand who's benefiting and who's not benefiting so that we can redesign, rethink, co-create strategies that are responsive to the educators that Caitlin just talked about. It always requires multiple perspectives. If you're talking to higher ed about credentialing and pathways, you're going to get one answer. If you're talking to educators, you get another. If you're talking to teachers in the higher ed programs and program directors, you're going to get another. And so it's really important, as has been mentioned, that we're using indexes and we're talking to multiple people to get multiple perspectives so that we can really understand the root of the challenge and address it from multiple perspectives. Caitlin also just mentioned, and I'll hint that that's one of the things we're going to talk about a lot more in our third workshop, the first in the series 2, is how do you engage meaningfully with the workforce? How do you build feedback loops to really understand their perspective, but also ensure we can be responsive? And anytime we lean into one perspective on research, we will likely get it wrong. It is really important that we're listening to educators and all of those involved in the system, or we actually just perpetuate inequities by excluding some and really leaning in and benefiting others. So with that, we've got a couple of polling questions for you. One, leaders and leadership can act on one or more of the 5 policy areas. So we talked about data, but data is so that we can have better strategies and better practices and better programs that offer financial resources, that address compensation. I see many of your questions are, do we have the kind of data we need to address compensation and financial relief? Data can help us in work environments. Do individuals have planning time or don't they have planning time? Do they have vacation? Do they have people in the room? Often educators are asking for supports and help. And what do we know about qualifications and educator supports? What's necessary for people to often take the next step? So answer this poll. You could check all the apply. But in your role and responsibility and authority, which of these areas are you really leaning into and could either responsible for or you can influence? I'll give you a few seconds to do that. And Daisy will let me know when we're looking good. Okay, Daisy, what do we have?
We're at 44% responses.
Okay, give it another 10 seconds and then we're going to go.
All right, here are the results on the
Okay.
screen.
This is so exciting. So each of you, we didn't disaggregate it by responsibility or influence, but influence is as important as authority and responsibility. But we have folks in the group on the phone listening to this webinar. 67% really feel like they can influence or have responsibility for qualifications and educational supports, 43% around work environments, 37% around compensation and financial relief, 30% around financial resources. And I'm sure Caitlin's excited to see 54% around data. And I think this is one of the points we want to continuously make, that regardless of where you sit, we all can have role responsibility or influence to shift the current conditions for the workforce. And so this next question is, have you started? So you may have role responsibility or influence, but have you started to take action to advance policies, practices, and programs that really benefit early educators in the framework that was offered by Caitlin across those 5 big areas? So we want you to do a Mentimeter here, and it's a slide scale. 1 is you haven't started, and 10 is you're fully implemented. Let's see how we're doing on that one. And the QR code is in the chat if you need that, versus the link actually is in the chat if the QR code doesn't work for you. So we can't tell who's saying what, but give us a sense of this group and whether we started or we're fully implemented. It'll help us design future conversations and offer you support. And we do want to do that through the multiple resources of the National ECE Workforce Center. Look at that. Look at that. So we're on the pathway. And why don't you, Daisy, hit the hump? So you see the variation. Well, we've got less people responding. If you're still responding, it's fine. It just shifts the number. So we're about 1/3 of the group has responded thus far. But we're really seeing that some folks are on the pathway and some folks haven't begun. And that's the reason for the center, is to help you take one step forward to advance and think about this work. And you can keep coming in. We may play this back for you next time so that you can see. But looking like data, we're doing it. We're above the halfway point on average around data. We've spent a lot of time on qualifications and educational supports, and that's fabulous, because asking people to do it without providing the support won't get us there. And we've got a fair number of people on the phone really leaning into compensation and financial relief. Looks like we got to do a little bit more work around work environments, because that creates the condition, and most people aren't feeling all the way there at this point. But this is great to know that everybody's on a train, hopefully. And those of you who haven't begun the work, the ECE Workforce Center is really here to help you take that first step forward. So with that, I want to turn it over to Dr. Kimberly, who is going to talk to you about the National Workforce Registry Alliance and really give you a specific way, one way that data can be collected and used. Dr. Kimberly?
Okay, thank you. I am very excited to talk to you today about the NWRA and the registries. I am the executive director of the National Workforce Registry Alliance. We are the membership home for 45 state registries across the country. I am located just outside of Washington, D.C. And for those of you who are new to our work, our mission as a nonprofit is to advance an equitably recognized and represented early childhood and out of school time workforce by strengthening data quality and establishing professional development system standards for the registries. In our vision, the nation will demonstrate its commitment to quality and early learning through equitable compensation of a well-prepared and adequately supported early childhood and out of school time workforce. And we think that can be done best by utilizing reliable workforce data to inform policy action and drive research. In 2021, we made a commitment to racial equity. We are vested in strengthening social justice and accelerating racial equity for our staff, our members, and for those they serve. And to us, equity accountability hinges on data accountability. And we believe that every member of the workforce counts and that the underrepresented members hold valuable insights. We're striving to elevate the voices of the workforce and of those who are adversely affected by our policy, action, or exclusion. And so today I'm going to share some high-level data points with you, and I'm going to just contextualize that very quickly by letting you know we did a landscape survey this past summer in August. We did invite all 50 states, the district, and territories to participate. We did direct invitations to whoever the representative of the registry was in that state. We did have 44 states and the district participate, a total of 46 registries because Florida has 2 regional registries. As I'm about to give you this data, I'm just high level letting you know 4 of these states are anticipating to go live in 2024, and 3 of them do not yet have a plan for their registry. So this is what the landscape looks like. Those teal colored states are the states we anticipate to go live. Rhode Island, excuse me, is another one that should be teal. The yellow states are states that have previously had a registry. It's either being redesigned or we were missing information or participation. The states that are white are states that do not yet have a plan for their registry. So one of the things we often reference is registries as sort of the umbrella that is encompassing everyone in the workforce. So when we talk about registry reach, it's really big. The total for registry users or members in registries nationwide is 2.6 million people. And the fun thing about registry data is that you can obviously disaggregate in many ways across role and setting and so many different factors. But in this case, when we looked at just the active users in the registry who are in direct care, that number is 1.2 million nationwide. So if we're going to look today at how data can inform policy and priorities and accountability as well as impact, I want to kind of take you through the data life cycle where registry data sort of comes from. So you'll see initially to even have workforce data in the registry, registries do a really important thing within the state, which is to engage the workforce as well as their system partners. That work includes being sort of a bi-directional information exchange platform. So making sure members of the workforce know about opportunities, training, as well as programs and support that are available to them. The next thing in that cycle is registries provide services and support. So in most states, the registry acts as backbone infrastructure for the professional development system. So they are doing approximately 12 common functions across all registries. And then there's another dozen or so that exist in more mature registries or registries that are a little bit more robust. The next thing that happens, of course, is a byproduct of those services and support, which is the data collection. That data collection exists because registries track the activity in those professional profiles over time. That data can then be aggregated or filtered. It can be analyzed to create reports. And then obviously we lift that up to inform policy priorities and accountability. So this is kind of what that looks like at this point. We know that in 44 states, registries are already doing a really good job on workforce engagement. They do provide those functions and services I just mentioned. And then if you look down at this yellow section, the data collection and verification, that's the section that we've been really focused on supporting quality and alignment. So data definitions, the data collection elements, the NWRA has a set of core data elements. We help registries collect and provide evidence that they meet our standards for quality. Once they do that, they can then participate in aggregate data sets. But nearly all registries in this area do collect demographic information such as race, languages spoken, socioeconomic elements, age, as well as role setting and ages of children they care for. When we look over here at the data access, it's important to note that most registries are not funded or equipped with data analysts, nor are they provided with funding to produce workforce publications. So this is something that we are trying to encourage and would like to see stronger research partnerships occur in this area. And then in terms of leveraging that to inform policy and priorities, again, registries have not been funded to support publicly accessed data. These are not publicly accessible data sets per se, nor are they funded to support the translation of data for utilization. So we're really looking for stronger partnerships with our advocacy system partners here. So today we're just going to crosswalk with you those 5 policy areas and how registries support that effort. In terms of qualification and educational support, registries do verify degree data in 90% of the registries. They also provide the service of placing individuals on the career ladder or career lattice in the states. In most states, they do approve professional development. They also provide planning and planning tools and guide people through that career pathway. About a third of registries also do scholarship administration or provide competency self-assessment tools. And in 8 states, they have micro-credential or badging systems in place. And about that many also provide resume builders using the professional's profile. The second policy area we're looking at is work environment. So the registries provide the following functions. For example, that infrastructure to access the workforce enables the collection of qualitative data at the individual level. They also track the hours that the workforce are working. They provide access to and track utilization of programs. And because registries are integrated with childcare licensing and the QRIS systems in the states, approximately half of states, 22, are integrated with childcare licensing. Most also integrate with QRIS. We can look at data from those programs and look at sort of what we call warm data, which are intersections of those different data sets. Another area is the compensation and financial relief. So registries can and do track wage data. This can be both self-reported. It is verified in about a dozen states. We also track employment data, which can include their employment status as well as the employment history, the hours that they've worked. ARPA funds is another example of how registries were used to collect information and track impacts over time. They did facilitate direct pay to providers in about half of the registries. They also track benefits data, and in a few states, they do track family structure as well. Okay, and so as we look at the workforce data, registries do have current workforce data in 80% of registries. So that's not data that we have to wait or go out and collect. That's existing. I call it near real time because typically it is. In about 40% of the country, the registry does do an annual or biennial update that's required. In 82% of registries, they are using a unique workforce ID number, which is really important because it allows us to track and look at or examine that data longitudinally, so over the course of somebody's career. The data that's provided is at the individual level. It is provided by the professional themselves. Often the director of a center can access certain levels of that data. So for example, they can see what kind of training data that person has. They can see if the qualifications have been verified. Here you're seeing some of those elements include geographic location, which could be zip code, it could be by county. Employer compensation data is in 87% of registries, as well as demographic, race and ethnicity. Language data is in there as well. So 82% of registries can tell you about the primary language that individual speaks. Approximately 40% can also tell you what their preferred learning language is. About almost 20% can also tell you about the languages that individual speaks with children. There are also well-being indicators, which include compensation, benefits, and paid time off. Again, we know that about 22 states require participation in the registry, which means those workforce data sets have high saturation, as well as representation of the licensed childcare workforce. And then finally, we have the financial resources. So registries support this with disaggregating for example, they can do the source of your funding, if that's getting tagged. If utilization is pushed through the registry, they can track that, and they can inform things like equity accountability. They do contribute to the local or state effort, as well as supporting the production of the QPR reports for the feds. So as I said earlier, states that have met our quality indicators can contribute their workforce data to an aggregate data set. In 2023, we had 16 states who were eligible and did participate in creating the nation's largest cross-sectional data set reflecting the workforce. That data set this year included 642,000 members of the workforce. We can project that that data set will reflect over 1 million members of the workforce by 2027. And it will include licensed professionals in most of the country. So this is the map just illustrating for you what the ARPA, how registry supported the ARPA funding. Again, this can look in a variety of ways. It can include making sure that the workforce are aware of opportunities, as well as being able to access the applications or links to participate in programs. Often it does include verifying eligibility, which registries already have that information. In many states, they also process those applications, supported direct pay to providers, as well as tracking utilization or non-utilization, and who those members of the workforce were. Here, I am just going to give you 3 examples. So we are holding up Illinois as one. They did use their workforce data to inform sustainable funding for scholarships to upskill the workforce. I will show you what that looks like in just a second. They also use their registry data for restoration grants, as well as workforce bonuses, and distribution of SRSA and ARPA funding. This is Ohio's dashboard. They used their workforce data to inform what they called hero pay, childcare subsidy analyses, as well as the dashboards that they created to analyze workforce churn. And then Nevada, who's with us today, is another example, and they're going to tell their story today about how they've utilized the registry to ensure access to telehealth, teletherapy, telemedicine, and some insurance coverage. So this is the example from Illinois. This is their scholarship dashboard. Again, you can see they can disaggregate by role and setting. They can look at utilization by zip code, priority populations. And this information was tremendously helpful in Illinois to inform the utilization of the program, the impact over time, as well as budgetary information about sustaining that effort. This is the dashboard example from Ohio. Again, they can disaggregate by role, so you'll see turnover on the left by job title. You can see where they've done some analyses looking at both those who stayed and those who left. And then down on the bottom, you can see that they can look at and examine that over time. This is by month. I've seen Ohio also do some really incredible stuff in terms of measuring impact of interventions and programs. So as you think about your registries, we'd ask you to think about working in partnership to lift the voices of the workforce, remembering that registries are the hub and the core of the professional development system that serves the workforce. We hope that you will examine the program access and utilization, as well as who's missing from your data and who is currently accessing supports and services or who is not. We also hope that you'll leverage your registry's workforce data to inform sustainable investments over time and to make equitable policy recommendations, as well as strengthening equity accountability. And with that, it is my great pleasure to introduce you to Shelly Nye from Nevada. Shelly is someone I have known for about the last 20 years. When she was hired to build the registry in Nevada, and I happened to live there at that time. It was very exciting that we were able to lift Nevada up at our conference last month and give them an award for workforce support. So I am very excited to introduce Shelly and her colleague, Maura, and let them tell you more about Nevada's program.
Grant here, you know, and that
Thank you so much.
is what I'm going to be looking for.
We're so happy to be here today.
When I see if
Excuse me.
anybody else,
Sorry, guys, I didn't realize I was on mute. So happy to be here today. If you could go to the next slide, please. So my name is Maura Snyder. I'm the Child Care Resources Coordinator with the State of Nevada Child Care and Development Program with the Division of Welfare and Supportive Services. And I am here with Shelly, but I'll let her introduce herself in a little bit and just go over what my part is. So next slide, please.
yeah, we talk about this whole red thing. You indicated it would be quarterly, but then I'm not. Yeah, I just fear.
Sorry, if you
that
could go
if
back
we
one
got
slide, that'd be great.
Yeah,
to the end of the year,
Mara,
I
we're
don't want
picking
it
up
to
another
be a bigger mess of,
conversation.
oh, we
in
under-
I
your
know.
office.
I'm sorry. I have someone right behind me.
Of
Is
course,
this
we
better?
do
Can you hear
have
me
that
now?
for that reason,
We
but if
hear
we
her
can
louder than
repair
you.
and get it
I'm
fixed
sorry, one
now,
moment. Okay, can you hear me?
Yeah, much better.
Thank you.
So next
Yeah,
slide.
Yes, thank you.
I'm gonna talk about why.
Okay, so the ECE system is often undervalued and unappreciated, as we've seen so far. And this is both within and outside the industry. A lot of times, even within the industry, we don't see ourselves as professionals. Professionalism is not something that is associated with early education and it should be. A step to seeing ourselves and having others see the ECE industry as professionals is to treat them like it. And that includes adequate paid leave, and benefits. So with the influx of funding coming out of the pandemic, we really wanted to give the EC industry in Nevada as many resources as we could possible. And it was really important for us to listen to our workforce. So time and time again with we had meetings with them, and we're out in the community, and a lot of times they kept bringing up benefits. They needed benefits. They had no health benefits. So we took that back, and we came across Optima and Allied Health through the Opportunities Exchange platform. So we reached out to them and started getting information to see if it would be affordable and doable for us to bring this to our Nevada workforce. We also wanted to partner with our Nevada registry, since they had already had a system in place to be able to get to the providers the information that was needed, and also gather that important data that we just talked about. So Optima, Allied Health, DWSS, and the Nevada registry worked together to form the project and process we have now. It was also vital for us to be inclusive of our Nevada early educators. We worked hard to be able to include the entirety of this population to bring much needed benefits to all of those who were boots on the ground. And I'll let Shelley talk about that in just a minute. But that was really important for us to make sure that everyone in our industry, no matter where they were on the scale or where they were in the ladder, were able to benefit from these benefits. Next slide. So included in our benefits is unlimited telehealth and unlimited telehealth for the provider and their family. So anyone in the household can be signed up, and they have access to, there's an app that they can do teledoc or telephone. And they have unlimited, 10 free teletherapy sessions per household per year. And that is for anyone in the household. So if your child has anxiety, if your husband is depressed because he lost his job or something, they can get on there and do the 10 free teletherapy sessions. After the 10 free ones, if they want to continue, it is at a minimal cost. I think it was about a $99 per session to be able to continue with that. And then in July, we added dental and vision to the coverage. This is for the registry members only that we are covering. However, for a minimal cost, they can add their family members, or they can up the coverage that they would like. This also includes a free employee assistance program, or EAP system. And this is really important because EAP is like a concierge for them. They can get on there and ask for any kind of help with anything, planning parties, planning retirements. They also have short-term counseling sessions. So if you don't feel like you need an actual therapy session, you can go and do short-term counseling through the EAP section. And they also receive a free discounted, discounted prescription card as well through this program. And then they also have the option to buy into voluntary whole life insurance policies for them and their family as well. We're really excited to bring all of these benefits to our providers, and the providers have been using them nonstop, and they're so excited about it. And it's free to them until at least 2025. Hopefully we can get more funding to go beyond that. But that's not only are we able to bring the benefits to them, but it's free to them, which is something that is not very available in this industry. So DWSS could not have done this without the incredible partnership that we have with Shelley and her team. She has been instrumental in implementing this and incredibly helpful and flexible in everything that we ask her to do. So with that, I will turn it over to Shelley to explain more of a portion of her work and the amazing things that she does.
Thank you, Mara. Next slide, please. I want to again thank DWSS for their partnership with the Nevada Registry, but also thank the National ECE Workforce Center for the invitation to talk about Nevada's telehealth program. We're really excited. Its momentum is building, and we're happy to have the opportunity to share what's been happening in our state. My name is Shelley Nye, and I am the program director for the Nevada Registry. We perform many of the functions and services that Kimberly covered in her presentation, including capturing data about the ECE workforce in Nevada. And we do this through career ladder placement, workforce support, training approval, and data collection. We are entering our 20th year in 2024, and we have a little over 8,500 active members statewide. Membership with the Nevada Registry is required by state child care licensing regulations for all individuals working in licensed child care programs. Maura covered the specific features of the telehealth program, and I'd like to just add to what she shared by further explaining that the telehealth program, it's a supplemental benefit for members and their dependents, as she said, not an insurance plan. So individuals do not need to have an existing health insurance policy to participate. And because it is not an insurance plan, individuals can enroll without affecting their existing policy if they already have one. It really is an add-on standalone service for non-emergency medical care. And as Maura said, not only is there no cost to enroll, there are no co-pays to pay. Individuals can avoid using PTO or unpaid leave to go and physically visit a doctor or urgent care when they are experiencing minor illnesses. So as you can imagine, the financial benefit is tremendous, but the convenience factor is immeasurable as well. And as Maura mentioned, it was important for the program to be offered in an inclusive way to all members of our ECE workforce, regardless of the setting in which they are employed. And so this made the eligibility criteria very simple. The first is that you must be an active member of the Nevada Registry. And secondly, individuals must be actively employed in childcare or another early childhood related program. So this includes all settings: licensed childcare, Head Start, tribal programs, before and after school programs, licensed family childcare, district-based pre-K, registered family, friend, and neighbor care, as well as unlicensed kith and kin providers. It also includes individuals who indirectly support the workforce, such as staff of our resource and referral agencies, scholarship programs, and licensing agencies. Basically, anyone working in an early childhood related capacity, directly or indirectly, can access this benefit so long as they are also an active member of the Nevada Registry. As Maura said, the program rolled out in February of this year and will be available through February of 2025. Next slide, please. We are incredibly grateful the state recognized the potential of leveraging the registry to offer these benefits to the entire workforce in our state. We did so in a streamlined way by creating a single point of access via the online portal our members already use to manage their membership with the Nevada Registry. And what makes it so seamless is that the data needed to verify eligibility already exists within our membership accounts. So this reduces the burden on our workforce and lessens redundancy by not requiring individuals to provide data already on file with the registry to yet another system or program. Creating the access point within the registry really was a minimal lift for us because we already had the system and infrastructure in place. We worked with our database programmers to build the gateway and eligibility process behind the scenes, and then worked with DWSS, Optima Benefits and Payroll, and Ally Health to develop the public-facing messaging. We also worked with Optima to create a customized spreadsheet that includes the data they need to fully activate the benefits within their service delivery platform. Because the eligibility is tied to the employment records of our members, we're able to provide continuous eligibility data to Optima. And the Optima team can easily see when a member becomes ineligible because of a change in their employment or membership status. In terms of process, accessing the telehealth program is a two-step process. Initially, individuals opt into the program from within their registry membership account and authorize the release of their information to Optima Benefits and Payroll. It's at that point that we virtually hand the project over to Optima and Ally Health. All communication from that point forward regarding the actual activation of benefits, which is step 2 of the process, comes directly from them. It's a very simple and straightforward process, which has really helped to ease the lift on our workforce to be able to access these benefits as well. We're beginning to collect utilization data from Optima through monthly utilization reports that they generate for us. And the report provides data about patient demographics. So we're looking at utilization by age, gender, type, whether it's the primary individual utilizing the services or one of their dependents. We're able to track the utilization by days of the week and time of the day, the usage trends, whether folks are accessing the services via their phone or via video, as well as repeat usage rates. We're able to look at medical analytics, including the types of diagnoses being made and types of prescriptions being ordered. There's also information about behavior activities in terms of the number of therapy sessions being utilized. And we have information about the EAP activity as well. It's really exciting. Even more exciting than just having the data is that according to Optima, the typical utilization for most groups is around 30%. We're seeing a utilization rate of 137% for telemedicine, which is amazing. That tells us that our members are really using the program. We're also receiving some great testimonials that highlight the benefit of the program to our EC workforce. And I'd like to just share a couple of those with you. One member shared that it was so convenient to use the telehealth when my son had a severe earache on a Friday afternoon and his pediatrician was not available. I was able to get an appointment and be seen online within a few minutes of registering for an appointment. The doctor was able to diagnose my son and get a prescription at the local pharmacy. I only had to pay for the prescription. Everything else was free. I will continue to use this service. No more waiting for hours at urgent care and paying a ridiculous amount of money. Another member shared, I'm grateful to this program offering teletherapy. As a busy teacher and parent, it's difficult to find time during the school day to make an appointment. Being able to use the teletherapy option has allowed me to work on my self-care during these trying educational times. We think these testimonials just speak volumes about the power of this program to really benefit our workforce. Just as a side note, the average wait time for telemedicine is only 6 minutes. So unlike going to an urgent care where you might sit there for hours before you're seen, this is so quick and so easy for those minor illnesses. And the wait time to get an appointment for teletherapy services is only 5 to 7 days, which if anyone has tried to access counseling services recently, oftentimes the wait is months. So it's a really, really great benefit. It's a huge cost savings and time savings for our workforce. Aside from the obvious benefit to our workforce in terms of providing that healthcare support, an added benefit from a systems level is that we now have better data than ever before because members are required to confirm their personal information and their current employment information prior to completing the initial enrollment process, as well as to maintain their eligibility. So we're finding that fewer members are allowing their memberships to lapse, and they're updating their employment more frequently, which is benefiting our state by having more accurate workforce data available. From a programmatic level, Optima and Ally Health have been great to work with throughout the entire process. They initially helped our state create a customized telehealth program based on the needs of our workforce and the available funding that we had at the time. And they have remained flexible in modifying our program as needed following our launch. It has been a very seamless process from a development standpoint as well. Next slide, please. In closing, I'd like to just again thank the National EC Workforce for the opportunity to share our telehealth program. I've included our contact information for both myself and Maura. Please feel free to reach out if you have any questions or would like more information about how we got this to happen in Nevada. Maura is a wealth of information. She was really involved with behind the scenes conversations with Optima and Ally Health. So she can definitely share, she has a lot of wisdom to share on that account. We've also included the contact information for Optima Benefits and Payroll. If you're interested in exploring telehealth options in your state, I definitely encourage you to reach out to Brandon DeCesar to initiate those conversations. They are wonderful to work with and open to new ideas. They're very supportive and have been just such an incredible support throughout the process. So with that, I would like to turn it back to Sherry.
Thank you so much. First of all, let me thank Caitlin and Shelley and Mara and Kimberly for the information they've shared with you today. You heard why data was important, you heard how to collect it, and you heard one way to use it. And we want to do this to be catalytic in your own thinking. As we go to the next webinar, we're going to be focusing on something that you heard in each person's story, the importance of listening to the workforce and collecting data from the workforce itself. So during webinar 3, we'll focus on the vital issue of the early care and education workforce leaders and what they have to say, and understanding the issues that will benefit them, both the things that are working, their assets, and the things that they'd like to see different, so that we can think about how we build relationships, partnerships, and network. This is really a team sport. We will be talking to you about integrating those perspectives with your quantitative data so that you can get to root causes and really build a network of people to advance change. So in preparation for the next workshop, we really want you to think about your workforce and who are you designing programs, policies, and initiatives for. And so we've got one polling question that we want to ask you to do. It has 4 parts. So we're going to launch it, and then I'm going to go through the 4 parts. The first part is, how do you currently plan, or how do you gather data about your workforce? So you could check all that apply around surveys and focus groups and interviews. The second question is, if you have data on your workforce, who's missing? Is it family child care, or center-based, or Head Start, or early Head Start, or licensed child care, family friend and neighbor care, regulated care, unregulated care, or some other specific population in your community that you know you're just not reaching? And then we want you to tell us a little bit about, from your workforce communities, which have you collected information from to really guide your work? Here we're thinking about ethnicity and race, our Alaskan Native, our American Indian, white, mixed race, Pacific Islanders, Asian immigrant, African American. Who are you listening to? And then finally, from which workforce communities have you collected information to guide your work? Thinking about geography. Has it been a rural population, an urban population, or suburban population? I know there are many more ways to separate geography, but just wanted to get a sense of those participating as we go into next month's session. And so with that, I'm going to turn it over to Julie. And we'll put up those answers, Julie, as they're available, where we don't want to hold people over.
Thank you so much, Sherry, and thank you everyone for participating in our Foundational TA Series webinar today. For those of you that have dropped questions into the chat, please rest assured that we will be sending out written responses to those questions, along with the PowerPoint slide deck and the recording of the webinar. So we're looking forward to seeing you all for our next webinar, which is scheduled for January 22nd. Before you leave, though, we ask that you just take a few moments to complete our post-webinar survey. So we're ending just 3 minutes early to give you enough time to get that done before you move on with the rest of your day. And the survey will open in your browser as soon as you exit the Zoom. In the survey, you'll have the opportunity to let us know how you'd like to go deeper with the content of today's webinar, and we will be using your responses to inform the structure of our first consultative session scheduled for January. We really want to make sure that this session is responsive to your needs and your interests, so please do take a moment to complete that survey. And here we are with our results.
And yeah, feel free to scroll through, but it looks like a lot of folks, Julie, are using surveys and focus groups, which is exciting. We hope they're building in feedback loops. More folks are getting information. Missing from their data is family child care, more than center-based, family friend and neighbor care for sure, unregulated care for sure. And which workforce communities have you collected information from to guide your work? Strong across all of the areas, a little less on Pacific Islanders, and 30% American Indian, 16% Alaska Native, but other populations may have been intentionally reached. And looks like, according to geography, we're about even on rural and urban, a little less on suburban. So we'll use that, Julie, as we plan and think about the next session and outreach.
Yes, thank you, Sherry. So as you exit the Zoom, you will get the survey. It will pop up as soon as as soon as we end this webinar. So thank you everyone for participating, and we hope to see you in January.